I'm going to start by saying that opiate pain medications are an incredibly complex and extensive topic, and that we're in no way trying to teach you all of it. However, what we want to do in this video is break that down into something digestible so that you aren't overwhelmed by a tidal wave of knowledge. Now, we're going to focus on 4 common opiate-based pain medications: morphine, hydromorphone, oxycodone, and oxycontin. There are numerous methods of delivery for these medications, but I'm just going to focus on oral, aka PO delivery, as well as IV delivery. At the end, I will talk briefly about how to convert dosages between these medications, as well as give you a basic idea of the dosages that you might see for these. We're going to start with morphine, which is considered a gold standard for opiate pain medications, not because it's superior, but because many other opiate-based pain medications are derived directly from it. Since most opiates are derived from morphine, they have similar side effects, which include nausea, vomiting, sedation, euphoria, constipation, urinary retention, dependency, depression, among other things. Now, morphine can be given both via IV or via PO, with the PO doses having to be 3 to 6 times higher than the IV doses because of issues with metabolism and absorption from the GI tract, but that's another topic entirely. Morphine generally works well to control pain for 3 to 7 hours, which is why you often see it written to be given every 4 or 6 hours as needed. Via IV, morphine will reach its max effect at around 20 to 30 minutes, and via PO, morphine will reach its max effect around 60 minutes. Next up, we have hydromorphone, aka Dilaudid. This medication is very similar to morphine, but is more potent, meaning it requires less to achieve the same effect. In fact, IV Dilaudid is about 8 times as potent as IV morphine. Dilaudid is thought to have less of a side effect profile, as well as a smaller risk for dependency, which is why it's often a good alternative if your patient cannot tolerate morphine. In terms of delivery, it can be delivered via IV or PO, with the PO doses having to be about 5 times higher for the reasons we discussed before. It generally works well to control pain for 4 to 5 hours, which is why you'll often see it written to be given every 4 hours as needed. Via PO, hydromorphone will achieve its max effect between 30 and 60 minutes. Via IV, hydromorphone will achieve its max effect between 15 to 30 minutes. Oxycodone is our next contestant. Again, very similar to morphine, but what's noticeable about this drug is that it's an oral medication, and you often transition your patients from an IV pain medication such as morphine to oxycodone for expectation of outpatient management. It is in no way the best one or only one, but it's a very commonly used one for PO transition. Oxycodone generally works well for 4 to 6 hours. We've already talked about oxycodone being a PO pain medication because of its good oral absorption. Its doses are generally twice that of IV morphine. For example, 20 milligrams of PO oxy is about equal to 10 milligrams of IV morphine. It takes about 1 to 2 hours for oxycodone to achieve its max effect. Oxycontin is next, and it's just really an extended release version of oxycodone. What this means is that oxycontin is also a PO medication, but works well for about 12 hours instead of the 4 to 6 hours with oxycodone, which is why you'll often see oxycontin written to be given twice a day or every 12 hours. Because of its extended releaseness, it can take up to 3 hours for oxycontin to reach its max effect. In terms of dosages, oxycontin is absorbed just as well as oxycodone, but because it's given every 12 hours instead of every 4 or 6, each dose will be higher. For example, let's say a patient is on 5 milligrams of oxycodone every 4 hours, which means that he gets 6 times 5 or 30 milligrams of oxycodone in 24 hours. This would mean that he would require a dose of 15 milligrams of OxyContin twice a day in order to achieve the same effect over the course of one day. Now, when you're in the hospital, the following scenario will come up pretty often. Your patient is going to go home from the hospital tomorrow, and you need to transition him from IV pain medications to PO pain medications as an outpatient. How in the world do you do that? You do this with help from what we call equal analgesic charts, which you can easily look up. What they tell you is what dosages of medications are needed to achieve the same pain control effect across different medications and delivery mechanisms. So for example, 10 milligrams of IV morphine requires about 20 milligrams PO of oxycodone in order to achieve the same effect. Similarly, 10 milligrams of IV morphine is equal to about 7.5 milligrams of PO hydromorphone. Just to give you an idea of what dosages you might see, so an opiate naive person might require 1 to 5 milligrams of IV morphine in order to achieve good analgesic effects. And you can convert this to the other medications based on this table. Now, fair warning, this is again just to show you how to use the table. Calculating pain regimen in actuality can be much more complicated and require consideration of numerous other factors. But if you can use this conversion table, you're off to a good start. Lastly, opioid pain medications are affected by kidney as well as hepatic function. So if your patient has damage to IV's organs, think carefully. Now, here are our take-home points, along with a few tables that summarize all of our main topics. Thank you.